Welcome to Storytime Radio Evolution. Fans of stories and tales, welcome back. This is Gianluca Ropolo in the Storytime Lounge. Today we'll have the pleasure of chatting with a dentist and endodontist. Let's welcome Dr. Claudio Farnararo. Hello, Claudio. Welcome.
Hello, it's a pleasure, and a greeting to all the audio listeners and video viewers.
First of all, how are you, Claudio? Is everything okay?
Everything's fine. Today, even though it's December and we're close to Christmas, the temperature isn't bad.
Exactly. I have to say it's quite nice today. So, dear Claudio, can you tell us a bit about how your career in dentistry began?
Well, let's say it was a free choice, so to speak, because coming from a family of dentists where my grandfather was a dentist, my father was a dentist, and I had several cousins. Although no one told me to become a dentist, it's inevitable that you're a bit conditioned by the family environment.
So in those classic family gatherings, at those big dinners, the topic comes up a bit, and the child, the young person, gets a little fascinated by those conversations. Maybe that's how it went.
Yes, let's say I was used to seeing my father studying his books. When I came home from school, he was always talking about, well, teeth.
And you grew fond of the idea, right?
In the end, yes, that's how it went.
Good. So, specialization and passion for endodontics. So, what pushed you to specialize in endodontics, if you do not mind me asking, right?
Endodontics.
Endodontics, my sincere apologies, and dental microsurgery procedures.
Let's say that endodontics is a very important branch of dentistry because, first of all, it very often takes away the pain that patients arrive with. The famous toothache, which many people recognize as a sharp or persistent pain in their teeth, is very often due to what is known as an endodontic problem. This means that the pain usually comes from issues inside the tooth, such as inflammation or infection of the dental pulp or root canals. Unfortunately, this important topic is not talked about much, either among patients or even sometimes among dental professionals, because endodontics is a branch of dentistry that is often underestimated. This is unfortunate, precisely because this area requires a fairly high level of expertise and the use of advanced technological tools and equipment for treatments to be truly effective and successful.
Okay, so there are fewer of them. Is that what you mean? Professionals specialize in this branch?
Yes, let's say it's not a real specialization, meaning that after university, we are all able to perform endodontics. Those who then decide to take additional courses, and I've taken several in Italy and abroad, let's say, you can reach a high level. And so inevitably, by investing in the profession, you can, let's say, do some things that maybe aren't done every day.
So are you happy to have taken this more particular and specialized path?
Oh yes, absolutely. Because it allows me to work, first of all, with the surgical microscope, which is a special piece of equipment that magnifies so you can see the dental details up to 7, 8, even 10 times. So I've always liked precision work ever since I was a kid playing with Legos, so I can relate to that.
Okay, so basically you're saying that modern tools and technologies help an endodontist do their job better?
Absolutely, yes. Precisely because magnification, the surgical microscope, and all those micro tools needed for root canal therapy or endodontic therapy today allow us to have success rates and to save teeth that were once considered a lost cause, so to speak.
Okay, so let's talk about the main topic, which is the value of preserving the natural tooth, which is what Dr. Fanararo was just talking about. So let's talk about your tooth-saving approach. Why is it important to try to save the natural tooth and not immediately resort to extraction?
Let's say it's truly an uphill battle because I sometimes genuinely feel like Don Quixote. This is because, unfortunately, there is a significant lack of information about what endodontics can actually do for patients. That is, saving thousands and thousands of natural teeth that are too often replaced with dental implants. First of all, we should think of a tooth as an actual organ of our body and therefore like a finger or an eye. So think about it. If we lost or, for example, cut off a piece of our finger, a phalanx, would we prefer to have someone reattach the finger or have a mechanical finger? The answer to this, let's say, is obvious when you think about our hands, but very often, unfortunately, we don't apply the same reasoning to our teeth.
Is it a cultural thing in your opinion?
In my opinion, yes, it's a cultural thing, absolutely. And so saving teeth allows us to save money, first of all, because it certainly costs less to save a tooth than to replace it with an implant. But then these famous quote-unquote dental implants that we hear about today are not without their own complications and problems. In fact, and not many people know this, dental implants can get sick just like teeth, and the complications affecting them are sometimes and very often much more difficult to resolve than if they occur on a natural tooth.
Is that because it's potentially a foreign body, right? The new one,
Actually, it integrates perfectly.
Okay.
The problem is that just as a tooth can get sick, for instance, from not being cleaned, so it must be maintained, when you have a problem with an implant, the complications are more difficult to eradicate than if it's a natural tooth. Furthermore, there's another thing to consider. The implant and the tooth that is built on top of it is still a man-made artifact. And surely in a few million years, Mother Nature has learned more than we have about implants and the things we can build.
That's for sure. Dr. Farnararo was talking about a battle, and the slogan is "Your natural tooth is priceless, Pam," which is what you see on the website, right?
Exactly. Yes, it's really my mission. Yes.
That's great. Moving on, you're also a teacher and a trainer. What does it mean for you to pass on knowledge to dentists, and what are the main challenges in specialized training?
Let's say that for more than 10 years, I've also been involved in teaching. I give private courses for both young colleagues or colleagues who want to, let's say, approach endodontics and raise their level. And let's say it's continuous growth for me as well, because every time you teach and show some things, it's always an opportunity for me to grow too. Also, because I also teach abroad, I travel very often. I came back 2 weeks ago from Saudi Arabia. And so engaging with colleagues from abroad and seeing different procedures or different approaches definitely enriches my knowledge base, which I can then apply in my daily practice and in the clinic for my patients.
That makes sense. It pushes you to inevitably stay on top of your game, right?
Absolutely. I never stop studying, both because I like it and because I'm always curious about any new developments that may exist to improve our professional life, that of our colleagues, but above all, that of our patients in the end.
When you talk about new developments, do you mean mainly related to technological innovations?
Absolutely, yes. Both technological innovations and possibly new instruments that are made available in our toolkit.
Can you share with us a particularly significant experience or a complex case that left you particularly satisfied with the result you achieved?
Of course, let's say it happens often, but there's a particular case of a young 25-year-old patient who had seen many colleagues, and they all wanted to extract the tooth and place an implant. He found me on the internet. He came for a visit with me. I managed to save his tooth. And just a month ago, I think, I called him for a checkup, for his 10th year checkup. So it was truly and deeply satisfying to have the trust of both patients and very often of colleagues who refer particularly complex cases to me. Confident that since I deal only and exclusively with this branch, the patient will then return to their practice.
Good, that's a great satisfaction, not only from the patients, but also from the colleagues. And well, that's quite something. But where is your practice, Claudio?
Well, actually, despite
Plot twist.
being the son and grandson of a dentist, and you can clearly hear from my accent that I'm not from Campania,
Exactly.
I emigrated to the South more than 15 years ago. My name is Claudio. I did a bit like Claudio Bisio in Welcome to the South.
You did the opposite. There you go.
Like in the movie. Actually, I've never opened my own practice and I'm a consultant, so I go to work in various practices where they provide me with, let's say, the instruments and technologies that I believe are up to the task of delivering the best results. So I work in Naples, in Castellammare, and in Torre Annunziata. Let's say on the website, by sending a message, depending on where the patient is, I can find a practice and cover, let's say, more areas.
Do you like carrying out your profession this way, if you don't mind me asking?
Let's say that now, at my young age of almost 50,
A young adult, come on, a young adult.
a young adult is starting to get a little more tiring, so I don't, let's say, rule out the possibility of opening my own practice. But very often, precisely because I like to travel, even outside of Italy, to teach, when you have your own professional practice, it's much more difficult.
True.
You always have to be on the ball.
Well, come on, there will surely be news about that, but in short, I seem to understand that you work mainly here in the Campania region, right?
Yes.
Dr. Fanararo is in love.
The activity, the clinical activity, my children support Napoli. I'm a Fiorentina fan because my father treated Battistuta and the Fiorentina team in the 90s. So I couldn't convince my children to support Fiorentina, but that's okay.
Oh, well, come on. Let's hope Fiorentina can recover. It's going through a period.
Oh, yes, quite sad, yes.
But anyway.
But I'm genuinely happy for Napoli because, well, let's say I'm not let's say a person who is an extremist in football. So absolutely go Napoli. I really do wish them the best, honestly.
All right. So if you want to learn more, Salvadente, it is the reference website. And then you can find Dr. Fanararo on Facebook, Instagram, TikTok, YouTube, LinkedIn. You can find him everywhere. Is there any advice you'd like to give our listeners on how to maintain dental health and prevent common problems?
So, definitely don't underestimate small discomforts, like bleeding gums or a sudden pain that appears in the same spot. Going to the dentist twice a year for me is mandatory, and most importantly, you have to go when you don't think you have any problems, because very often when you already have symptoms, unfortunately, procedures that could have been very minimally invasive often turn into something more serious.
It's a bit like when we talk about a psychologist, right? You don't necessarily have to go when you're at the end of your rope, but maybe go sooner to feel better, not for any other reason, right? Obviously.
I agree.
All right, Claudio, it was a real pleasure to meet you. We say goodbye and wish you the best of luck for the continuation of your professional career.
Thank you all very much. It was a pleasure to be with you.
Until next time. Bye.